Hello, everyone. This is Dr. David Green with R3 Stem Cell. It is 5 o'clock here on the West Coast, and I really appreciate everybody who's shown up to watch today. I will kind of do a little dance here for a couple minutes to give more people time to check in. Anybody who has questions, please feel free to ask them on the chat box. While we're giving a couple minutes here, I'm going to pick a poll question. It's actually true or false. All right. Question is all amniotic fluid on the market is the same? All right, I'll leave that up there for a little while. All right, so I'm going to go ahead and get started. And this will be recorded, so we'll have it on our website for a replay, and you guys will all get a link to that in your email, after the webinar. And I'll mention that again in case somebody misses the first 10, 15 minutes or whatnot. All right, so the 411 on avoiding surgery with amniotic stem cell therapy. Okay, so the goals here are one, to provide a background on the current state of affairs with regenerative medicine. Two is to clarify how the FDA looks at stem cell treatments in this country. Three is to delineate the differences in the available stem cell treatments. And four is to set the record straight on amniotic therapy. So here's my promise to you. If you stay with us till the end, you will get a special offer that will save you a considerable amount towards an amniotic stem cell treatment. Okay. Also, over the next 30 minutes, you will learn a lot about amniotic stem cell therapy and walk away with a very good understanding about the treatment. Now, just to give you an analogy of where we are with regenerative medicine, 30 years ago, plastic surgery was like 90% operative. Now it's about 90% non-operative. I don't know if you've heard the commercials for Cool Sculpting, where they freeze the fat, Botox and epidermal fillers, Latisse, all these types of things that really don't involve you going into an operating room. It's changed the whole field of plastic surgery. So with regenerative medicine, we're going to see the same trend over the next 2 decades. We're already seeing it. So a lot of people who do webinars feel the need to do a lot of slides about themselves. I'm just going to do one. All right. I think it's important, to at least set the stage. So this is me on the right here. I went to medical school at University of Virginia. I trained as an orthopedic surgeon at Brown University. Got my MBA subsequently from Arizona State University. I left practice over 10 years ago to pursue full-time business interests. And about 5 years ago, I founded R3 Stem Cell. So we currently have over 25 centers of excellence nationwide that have performed literally thousands of successful stem cell procedures and PRP as well. I'm married. I have, this is my wife, Debbie. We have 4 kids. Sam is 16. Carson is 14. Ari's now 3.5. And little Charlie's just over a year. And we're done. All right, so that's me. Okay, so surgery, when you're looking at most medical conditions, truly should be a last resort. Arthritis of the spine or extremities, it's not a deadly disease. It never killed anybody. Granted, it can make your life extremely uncomfortable, but you really should exhaust conservative treatment before the quality of life decision is made, for an operation. A joint replacement, while it can be a very, very, very good procedure, It is a major procedure. It does have some risks associated with it, and the implants are not meant to last forever. All right. Now, traditionally, the available options for tendonitis, arthritis, sports injuries, they do help a lot with pain relief, but none of them to date have really helped repair the damage. All right. So with regenerative medicine, that is no longer the case. Regenerative medicine combines repair and relief. So no longer do you have the proverbial Band-Aid treatment. You actually have some repair, regeneration, and some long-term relief. So why is regenerative medicine now mainstream? Before I get into this slide, I'm going to switch to another poll. So I think it was pretty clear from those who participated in the poll that a lot of people understand that all amniotic fluid on the market is not the same, because they answered false, and that is correct. And I'll explain why in a bit. But let me just switch to another poll here. Let's see. All right, this we'll get into, but I just wanted to. All right. Is amniotic fluid regulated as a drug or a biologic by the FDA? I figured I'd ask it now because I'm going to answer it in a few slides. All right. Why is regenerative medicine now mainstream? Well, it works. We have a lot of studies now which show that the various types of regenerative medicine work, whether you're talking about PRP, platelet-rich plasma therapy, which is not a stem cell therapy, but it does have some growth factors, a lot of platelets in it, so it does work. And then you start looking at the stem cell therapies. There are plenty of studies now with hundreds of patients looking at 6, 12, 18-month outcomes. So the results are often long-lasting. It's a very, very safe procedure. The regenerative biologic reacts to the environment in which it is placed. All right, so it's effective for a lot of conditions, which I'll show you in a moment. And it's less expensive than major surgery. Okay. Now, we're heading into a new normal. And the reason is that we're treating the actual problem and modifying it. You know, when you have a treatment like a cortisone injection or radio frequency ablation, those treatments work very well, but they don't modify anything. Okay? So if you can actually heal the cartilage, tendon, or ligament and not just mask the pain, that's what we want as the new normal. It's a very exciting proposition to both patients and providers. So here's a list of the regenerative options that are available today. The umbrella includes things like nutraceuticals, which is they're available over the counter. You can get them at Walmart. They consist of chondroitin and glucosamine. They've been around for a long time. You know, I kind of vaguely call them a regenerative treatment, but there has been some slight evidence showing they can help protect some cartilage and maybe grow a little bit more. PRP therapy is a regenerative treatment, but doesn't involve any stem cells. It's more of a stem cell activator, and we'll talk about how it's done in a moment. Yeah, prolotherapy and prolozone therapy, which don't involve any actual medication, maybe some saline, but they've been shown to be pretty helpful at regenerating some soft tissue. Then you have viscosupplementation, which is a fancy schmancy word, which basically is short for hyaluronic acid, Synvisc or Hyalgan or the brand names. Insurance does pay for some of those. And there is a theory, we haven't shown this in the lab or in reality, but the theory is that injecting hyaluronic acid can help your body to promote the creation of more cartilage. But that's a theory. And then we have the stem cell therapies. So where are these regenerative medicine treatments applicable? What specialties? Well, there's a long list. And the reason is that we keep finding more applications for them that work well. All right, so pain, orthopedics, cardiology, pulmonary, the aesthetics world for either helping with wrinkles, or there's now a stem cell facelift, hair restoration it works well for. I'm just going to give you two examples of the expanding uses. A recent study came out looking at, amniotic stem cell therapy for pelvic pain due to what's called pudendal neuralgia. All right, it's a common condition, and they looked at quite a few patients who received the amniotic stem cells, and it worked really, really well, dramatically well. Okay, so that's an expanding indication. And another one is in the world of urology. They did a large study looking at amniotic stem cells for erectile dysfunction. And they injected it around the base of the penis, and it was able to help create new vasculature, promote new vasculature, which then helped cure the erectile dysfunction. I hate to use the word cure. It helped dramatically improve the erectile dysfunction. All right, so before we get into this, I wanted to give you the results of the poll. 86% believe that the FDA regulates amniotic fluid as a biologic, and 14% said drug. So keep that in mind. I'll show you the answer in a couple slides. All right, there's two major target markets when you talk about regenerative medicine treatments. The younger population is mostly athletes, whether it's amateur, weekend warriors, elite athletes. All the professional leagues have been okay with these treatments. PRP, stem cell, none of it is a performance-enhancing drug. Okay, it helps them avoid surgery for meniscal tears, labrum, ligament, tendon injury, degenerative disc disease, for both acute or chronic injuries. This might be a golfer's elbow or a ligament sprain. Then when you get into an older population, and I don't mean that as an older population, I'm talking about people who are late 40s like me up to 90s. So it's a broad range, but arthritis is the number one treatment target, whether it's rheumatoid or osteo or post-traumatic, like a cartilage defect. Also, you have overuse conditions, whether it's a rotator cuff, partial tear, or tendinopathy, spinal arthritis in the neck or the back, might be failed back surgery situation. Non-healing wounds, whether it's peripheral neuropathy or diabetic neuropathy, these work like gangbusters. The studies are very, very impressive. And then hair loss and wrinkles, like I mentioned, for aesthetics. Now, the indications for treatment. On the left are the very common ones that I just mentioned. And on the right, it's being offered for such things as RSD, diabetes, COPD, Parkinson's, occipital neuralgia, incontinence, pelvic pain, macular degeneration, and kidney failure. So basically what I'm telling you is that it's not just being injected into a joint or soft tissue. There's also a lot of doctors doing it systemically and having great outcomes for all of these conditions. So when you look at the different types of products, there's those that involve a harvest from the patient, and then there's those that don't. So on the left-hand side, you have PRP therapy, which is a simple blood draw. There's no stem cells in it. It gets put into a kit and spun around with a centrifuge. It has about 8 growth factors. It has a lot of platelets, and then it's injected, into the problem area. All right, so that's a simple blood draw. Adipose tissue, which is fat, involves a liposuction. It gives very high stem cell counts. Unfortunately, over 80% of those stem cells die within 48 hours after you move them from, say, the buttock to, you process it and then put it in the knee. Bone marrow is, as you can see in the picture here, a decent-sized needle is put into the iliac crest, which is part of the pelvis around the hip, and you draw out a certain amount of fluid, and that goes into a kit, which is then spun around really quickly and then injected back in. So those are the main ones that involve a harvest. Now, for those that don't involve a harvest, the top one is amniotic stem cell therapy, which has quite a bit in it. Hyaluronic acid, such as you have in Synvisc, cytokines. There's over 70 growth factors, and there are actually a lot of stem cells if it's processed correctly. That's why I put the 2 asterisks, because we'll discuss that. And then there's umbilical cord blood. It's kind of a new product. We don't use it or recommend it because when you have cord blood, it has MHC factors, meaning that there could be an incompatibility between patient A versus B versus C. So there can be a rejection reaction, which you don't see with amniotic fluid. So now Synvisc is an insurance-based treatment that is hyaluronic acid made from rooster combs, believe it or not. But those like Hyalgan and Orthovisc, they're pretty much all the same. Now, how does the FDA view stem cell therapy products? All right, so when it comes to the kits, the bone marrow, the adipose kits, these kits are typically FDA 510K cleared as medical devices. They don't contain the actual biologic, right? So the kit can be shipped to a medical practice and sit on the shelf for 2 years. When they get used, it's your own biologic, your fat tissue or the bone marrow that gets put into the kit and then spun around. All right, so it's just an empty kit. Now, the human amniotic tissue is regulated by the FDA as a biologic tissue. It's not a drug. It doesn't have a label, so it cannot be approved or denied. One of the top 5 questions that we get on our Facebook page all the time is the amniotic tissue FDA approved? It's not. It can't be. So it gets regulated heavily as a biologic, and when it gets processed at the lab, it has to go through some very significant FDA, they call them current good tissue practice standards. So those have to be abided by. And then our lab also uses what's called American Association of Tissue Bank standards. So they get tested for all the usual, the HIV, hepatitis, syphilis, infectious diseases galore to make sure that the product is clean. And we'll get into that more in a second. Okay, so in the U.S., the FDA has divided these products into minimal manipulation versus maximal manipulation. So this is important to understand because that's why people sometimes go out of the country to get treatment. So minimal manipulation has been okay in the U.S. All right, these are procedures that are done in the same setting. So you don't go and get your bone marrow drawn and then come back a month later. That's not the definition of minimal manipulation. It has to be the same setting, okay? None of the fluid or tissue is cultured. All right, because if you do that, the FDA says, aha, you've turned it into a drug. And we don't allow that in the U.S. Also, there was an issue a couple years ago with adipose tissue that they were putting enzymes through it and basically changing the biological structure of the material. The FDA frowns on that because, once again, they call that a drug. So if a practice in the United States is expanding the cells in the lab, or they're adding a significant amount of enzymes or additives that change the biological structure, that is a no-no, and the FDA hates that. Practice will get sued. Maximal manipulation is not okay in the United States. There have been several lawsuits in the past years about that. The FDA wins because that is called turning the biologic into a drug. Doesn't matter whether it's bone marrow, adipose, or amniotic. You just can't culture. I think eventually it might be fine in the U.S., but the FDA has not approved that. So that's why these labs are in countries like Mexico, the Cayman Islands, Caribbean, Cozumel, Panama. That's where people go to get those done. So has any one particular product proved to be superior? I should have done a poll question on this, but the answer is no. We follow studies regularly. We actually have an IRB-approved study now, but basically, you can look at all these studies, but you will not find anyone that has shown superiority of bone marrow versus adipose versus amniotic. They've all been shown to be extremely beneficial. Because of this, the products that do not require a harvesting make the most sense to utilize. That's the way that we look at it. That's the way that our practices look at it. And 95% of the inquiries and phone calls we get from prospective patients are asking for the amniotic. So first of all, I apologize. This is pretty small writing, but essentially this kind of lays out the differences between the 3 materials. So I want to start with bone marrow. Go back to chat here. Okay. Now, when you look at bone marrow, there was a study that looked and showed a 29% incidence of chronic pain. And that means, you put a big fat needle into the iliac crest, and the patient may have some pain from that for months. I know that when I used to do spine surgery, when I was back in practice, we used to have a lot of patients coming back saying, my back feels fine. It's my hip that's killing me. So it can be very painful. Banwart and all did a study back in the 90s that found major complications occurred in 10% and minor complications occurred in 39%. So these donor site complications may include pain, nerve injury, arterial injury, fracture, bowel perforation, SI joint instability, or herniation of abdominal contents. So just need to be aware of that. It may be that everything turns out fine, but these are not insignificant percentages. When you look at adipose, there are advocates who say that this method has the most stem cells of any other. They're right. It does have more stem cells than any other treatment by far. The problem is that Ross and al. Showed a few years ago that up to 80% of the fat grafts die within days. So you take fat from the buttock, you process it, you inject it into the knee or the hip, whatever the problem area is. Unfortunately, there's not enough oxygen to let that material survive. So there is a newer method of adipose stem cell therapy called SVF. It stands for stromal vascular fraction. And that does help with some cell viability. So, why doesn't everybody do that? If it has the most cells, the problem is it's a 6-hour procedure. It costs over twice as much, for which superiority has not been shown. We're talking about 10 grand-ish for those procedures, which is, for something that's really not been shown to be that much more effective. Why? I guess I'll just leave it at that. Why? With amniotic, you don't have to harvest anything. There's no ethical concerns. The fluid is obtained not from an amniocentesis. That's what a lot of people think. But no, there are risks with an amniocentesis, right? So basically, a woman undergoes a scheduled C-section. The woman is consented, compensated. The hospital is compensated. So everything's on the up and up. And sterilely, the fluid is obtained after the baby's born. Baby's fine. Normally, as most people know, the amniotic fluid is just discarded. So it's obtained, it's sterilely taken to the lab, it's processed according to FDA standards, and then it's cryopreserved. There's no rejection. It's an immunologically privileged situation, and it contains over 75 growth factors along with antimicrobial elements. Our clinics that are our centers of excellence have done thousands of procedures. We've had one documented infection. Let me repeat that. We've had one documented infection after thousands of procedures. Think about what the amniotic fluid does. It surrounds the baby. It helps provide nutrients. It helps provide protection. And, there's some very, very good elements in it. So these procedures are fast. There's no harvest or centrifuge necessary. And we'll talk about the stem cells that are live in the fluid. So here's an overview of amniotic stem cell therapy. It's effective, it's safe, and it's easy to administer. Amniotic products, as I mentioned, are FDA regulated as a biologic, and they are tested for a complete array of diseases. And this includes the FDA array of diseases along with the American Association of Tissue Banks. If you want to see a list of the diseases that are checked for, we have that, but it's very comprehensive. So these are not embryonic stem cells. So embryonic stem cells are what comes from, fetuses. And that's what was outlawed by George Bush administration, because there was a lot of concern over how these stem cells were being obtained, from aborted fetuses. So that's no longer the case. These are mesenchymal stem cells. They are, they're not adult stem cells because they come from the amniotic fluid, but they're much more like adult stem cells than they are embryonic, if that makes sense. They're minimal manipulation only, as I mentioned, comes from consenting mothers after a scheduled C-section. And the fluid is processed and then it's kept cryopreserved until use. And I'll talk about the cryopreservation process in a second. It only takes 10 minutes to thaw out. So for instance, when one of our practices is going to do a procedure, let's say, what's today, Tuesday? If it was going to be done on a Thursday, then the fluid could could arrive overnight tomorrow. And it's on dry ice in the vial, like as you see. So what would happen is it would just sit there till the next day when the doctor's ready to do the procedure, takes it off the dry ice 10 minutes beforehand, lets it thaw out, and then dilutes it with some saline or sterile water, 2-to-1, 3-to-1, something like that, and then injects it. That's it. I mean, you really don't have to do a bunch of processing. Now, what's in the amniotic stem cell fluid? Well, there's no steroid involved at all. Okay, steroid is a humongous anti-inflammatory, and it doesn't do any healing. So there's no steroid there. It has a lot of hyaluronic acid in it, which is great because the hyaluronic acid is basically the motor oil of our joints. So it does help with lubrication. There's over 75 growth factors, and these help promote regeneration of tissue. There are cytokines, which are mediators of inflammation. So, for instance, these procedures work really well in those who have inflammatory arthritis, rheumatoid arthritis, psoriatic, lupus. It really helps to modulate inflammation. And there are a significant amount of stem cells in the product that we use, and I'll explain that right the next slide, I think. Just looking at some of the outcomes. I don't know if you recognize these folks on the right. This is Hines Ward. He was a longtime player for the Pittsburgh Steelers. Years ago in the playoffs, he got injured in week 2. He had a collateral ligament sprain. The concern was that he was going to be out for the Super Bowl. But no, he had a regenerative medicine injection. Within 2 weeks, he was back in the Super Bowl, and he had a very good performance. Then you look at the case of Bartolo Colon. Now, Bartolo Colon is currently in his mid-40s, and he's still pitching for the Mets. Years ago, his shoulder was hurt so bad he was out of the game. So he went to the Dominican and got a stem cell injection into his shoulder. And within a year, he was back playing again and ended up going to several more All-Star games. So he did not need surgery. Regenerative medicine saved his career. So let me just present a few studies to you here. Basically, for every one of these cases that are well publicized, there's hundreds of others who have had these procedures and not told anybody. Because the league doesn't look at it as a PED, so they go and they get the procedure and they get back to their career, so they don't have to have a surgery on their record and they don't really have to tell anybody. Now, cryopreserved amniotic suspension for the treatment of knee osteoarthritis. This is a recent study. There were no adverse events, and there was excellent pain relief in over 60 patients over a 12-month period. Efficacy of autologous bone marrow concentrate had also excellent outcomes, but 9% adverse events. So none versus 9%. Now, there are too many studies to list on the effectiveness of the regenerative biologics for joint arthritis, spine arthritis, neuropathy, wound healing, back pain for degenerative disc disease, or rotator cuff tendonitis, and more. We do have a list of research studies available to our patients. Now, I want to go through some Mythbusters. This is very important because a lot of competitors of amniotic products say that none of them have any live cells. That is just not true. While there are plenty of companies who don't have live cells, for instance, ours has a lot. Now, if the lab radiates the product, and plenty of labs radiate their product, why do they do that? Well, they want to make sure that that it's sterile, so it can be used on an operating room field. They want to make sure that they abide by the FDA, and they may just want to do radiation to kill any live cells. Or if the lab adds too much of the wrong preservative, then it can kill all the stem cells. So those are the two biggest reasons that an amniotic product will not have live stem cells. Either it's been radiated or there's a ton of preservative that was put in it. So Robinson et al. Back in the 90s looked at various viability with stem cell preservation. And they used DMSO, which is dimethyl sulfoxide. It's a cryoprotectant that is supposed to prevent freezing damage to living cells. Now, what they showed is that there was significant stem cell viability after thawing if they use 20% DMSO at a cryopreservation at negative 80 degrees, not negative 200. So various companies will tell you, and they've told us, that stem cells all die if they're not cryopreserved at negative 200. I mean, that's just not true. This proved it. So this was at negative 80 degrees, and ours are kept at, I think, negative 82 degrees. And if you use less than 20% DMSO, you can preserve the stem cell viability. This was another study done back in 2007. What they did is they looked at 4 freezing protocols looking at viability. And all 4 of them showed cell viability. Some cryopreserved it very quickly. Others did it kind of slowly. They looked at different temperatures. But all of them showed cell viability. It's just different percentages of cell viability. So when people say that cryopreservation kills all the cells, that's just not true. And this is the proof in these 2 studies. Now, this was an article back in 2007 out of the LA Times talking about researchers have found that some stem cells in human amniotic fluid appear to have many of the key therapeutic benefits of embryonic stem cells while avoiding the ethical issue. So the stem cells, which are easy to harvest, but it's not amniocentesis, which this says. This is after a scheduled C-section. But they were able to create bone, heart muscle, blood vessels, fat, nerve, and liver tissue. So here's another study. Discovered that placenta is a new source for harvesting stem cells. And this was out of a children's hospital in Oakland. And more specifically, the discarded placentas of healthy newborns. Study finds there are far more stem cells in placentas than in umbilical cord blood, and they can be safely extracted. All right, here's 2 more myths. Bone marrow is better. All biologics have been shown to work well, but none have been shown to be superior to another. All right. In fact, let's look at some interesting statistics. At birth, 1 in 10,000 cells in your bone marrow is a stem cell. Okay. Now, by the age of 70, 1 in 2 million cells in your bone marrow is a stem cell. So there's a consistency problem. And a lot of it depends on how a person ages and their, biology. But as you age, that's a dramatic drop-off. So when I was at Brown University, the surgeons did a study looking at how many stem cells come out of the bone marrow when you do an aspiration. Well, they found that in the first 2 cc's, which is not that much, right? 2 cc's. In the first 2 cc's, that's where you get most of the stem cells. The rest of it is just blood. So that's also a problem. So when you look at somebody who's over the age of 50, 60, 70, you're not getting very good biology from the patient. So this argues for amniotic as it's much more consistent. We've had our product tested at a third-party reference lab, various lots, and those lots were uber consistent with the amount of stem cells that resulted, as well as the growth factors from lot to lot. All right, myth number 4. It's not FDA approved, so it's no good. We hear this all the time. Amniotic fluid is regulated by the FDA as a biologic under FDA 21 Code of Federal Regulations, Part 1271. And what that means is it can't be FDA approved or denied. It's regulated as what's called an allograft, and it's not a drug, so it has no label. All right, so just because it's not FDA approved, it doesn't mean it's no good because it can't be FDA approved or denied. So in conclusion, regenerative medicine has changed the way that we look at orthopedic medicine, as well as now starting to look at internal medicine and other aesthetics. And every week it seems like there's better results coming out for conditions that we never thought could be treated with stem cell therapy. Now, non-surgical treatments can alter the conditions with some repair, regeneration, and long-term relief. I don't use the words cure or heal because you're not going to take a joint that has, let's say, bone on bone and make it normal again. You're not going to take a shoulder that has a large rotator cuff tear and put those 2 ends back together again. What you're going to do is get some regeneration and repair, and that may be enough to provide long-term pain relief, help a patient avoid surgery. So treatments are safe, outpatient, have been shown in numerous peer-reviewed studies to be over 80% effective for arthritis and other musculoskeletal conditions, tennis elbow, golfer's elbow, Achilles tendonitis, plantar fasciitis. It's a long list. Once again, no particular treatment method has shown superiority. All are beneficial. You don't have any harvesting when it comes to amniotic stem cell therapy from you. It's immunologically privileged, and it works extremely well without causing any rejection reaction. Over 85% of patients in peer-reviewed studies are achieving excellent outcomes at our clinics while avoiding or significantly delaying surgery. All right, so what I wanted to do is let me show you the offer. Okay, so I want to thank you for spending this half an hour or 40 minutes with us. My goal here was to basically show you that a lot of the naysayers and competitors out there that badmouth amniotic, really maybe just tested 2 products years ago. They have not looked at the more modern products such as what we offer that have been tested by a third-party reference lab. So as a thank you for spending time with us, if you book your appointment with us either today or tomorrow, we'll give you a free consultation and $500 off your procedure, or 20%, whichever is higher, okay? I don't want you to think that you can combine offers. It has to be one or the other, but you can combine the free consult with the $500 or 20% off, okay? So when you go on the site at r3stemcell.com, we do have a practice locator, but we've been adding practices every week due to our popularity recently. So either just call us or email us. There's a form on the site, and we will get in touch with you to get you scheduled. We have a center right in Oklahoma City. We have a couple in the Phoenix area, actually several. We have one in Kirkland, Washington. We have several on the East Coast. We have centers in Chicago and Denver, like 3 in LA, 4 in Orange County, 1 in San Diego. So I'm just rambling off the top of my head. All right, so at this point, I wanted to take any questions that anybody has. Trying to see. Oh, yeah. Hi, Dr. Pierre. Let's see. How do I? All right, so Dr. Pierre is asking, for a non-healing wound, would you inject the amniotic fluid product directly into the wound? So I'll just answer verbally. Our doctors do some of that. Dr. Werber, who owns our lab, has done hundreds of these cases. So what he will do is we have a product that's called an amniotic membrane. The amniotic membrane product is made from the placenta, and basically we have a video that's on our YouTube channel, Stem Cell Therapy for Wound Healing. And I go through the differences between, the traditional stuff like apelograph versus amniotic membrane. And the healing was more than twice as fast. And there are some Q codes for Medicare if you want to use those. But basically what the Dr. Werber will do is he'll put the amniotic membrane on the non-healing wound and then inject the amniotic fluid around the wound as well as some of it into the wound, because it's amazing for neovascularization. Okay. So now there's a question about cost range. So when we have a center of excellence, we don't tell our centers what to charge. And there's reasons for that, and I'm going to explain them right now, is that there's a difference between obtaining treatment in LA versus Beverly Hills versus Oklahoma versus Indiana. And it comes down to two things. One is the competition, because competition usually means better pricing. Two is, well, three things. Two is the quality of the doctors that are doing the procedures. And the other, totally blanking on the other one. But anyway, let me just get to the answer. So for PRP therapy, which, as I mentioned, does not have any stem cells in it, it's a stem cell activator, costs range between $400 and $1,200. All right. Now, some of our centers just include PRP along with the amniotic. And that's, a nice benefit. And I think the two work nicely together. Ross, you had another question. I'll get to that in a second. Now, the cost for the stem cell treatment is anywhere from $2,250 up to $6,000. Now, that may include multiple joints being treated. That may also include several follow-up visits. It may include some prolozone or prolotherapy along with it. So there's just because a pricing is a little bit cheaper does not mean that it's the one you should go for, because they may be using a product from Mimetics or something that has no live stem cells in it. So, which actually leads me nicely into the question I just got about what do you think about what Regenerative says about amniotic fluid. So I am not one of these guys who mudslings and talks bad about other companies. For instance, you'll notice I didn't mention any other company name in this presentation because that's not the kind of person that I am. That is not the kind of folks that run Regenerative. What Regenerative did years ago is they took probably 2 or 3 amniotic fluid samples, and they basically showed they had no stem cells in them. So they extrapolated that to the whole industry and said that, oh, no amniotic fluid has live stem cells in it. Well, that's not true. It depends on how it's cryopreserved, what kind of preservative is used, and how much. If you use over 20% DMSO, it's probably going to kill all the cells. Okay? So if you use the proper amount of cryopreservative, do the cryopreservation properly, then you can get live stem cells. And we've shown that in a third-party assay from a reference lab. So that's what I think about what Regenerative did, is that they cherry-picked the fluid that they and then, of course, the owner of Regenerative badmouths in the blogs, Amniotic. There's a protection of his brand, but I'm not going to sit here and badmouth Regenerative. Now, you asked, what about enhancement of cancer? It's a very good question, and in the world of embryonic stem cells, here's an example. They did a study in baboons years ago using an embryonic stem cell product, and they were looking at treatment for degenerative disc disease. So degenerative disc disease, it's a very low metabolic output and very limited potential to heal. So the potential for a stem cell therapy into the disc is tremendous because it just doesn't heal on its own. So when you put the embryonic stem cells into the baboons in the experiment, about 1/3 of them developed tumors. And the tumors were called chordomas. The problem with embryonic stem cells is a lot of times they don't know when to stop replicating. They just replicate and replicate and replicate, and they just don't stop. So that can develop tumors. Okay? Now, in the treatments that are used, such as amniotic and bone marrow and adipose, none of those have embryonic stem cells in them. So what happens is you do get replication. You do have the ability to differentiate into cartilage and ligament and tendon, and as you saw from the Children's Hospital in Oakland study, heart muscle and things like that. But they do know when to stop. They don't turn into tumors. We've never seen that. That's never been shown because they're not embryonic. and they do have a turn-off switch. So you were asking about the difference between the use of amniotic compared to umbilical fluid. So the newest product is an umbilical cord blood product. The problem that we've seen with that is that there is at least a 10% incidence of a rejection reaction. So in the thousands of cases that our centers have done, we've never seen a rejection reaction because it just doesn't happen. Amniotic fluid, after it's processed, it has it's immunologically privileged. It just doesn't have a rejection reaction. Not the case with umbilical cord blood. So I just, the goal of all of this is to really help patients and do the least, potential for harm, right? So that's what the concern is. We get such great outcomes with the amniotic fluid product that our centers use that that's the issue. All right, so your next question was, what about stem cells for autoimmune disease or COPD? So I can't sit here and point to large studies for that, but I can tell you that we have a lot of centers that are doing treatment for COPD, and the results have been very good. I don't want to say miraculous, but they've been over 65% good. Not 90%, but about 65%, extremely beneficial. For autoimmune disease, they've been nothing short of spectacular, because what happens is with the cytokines that modulate the autoinflammatory response, what you get is you get a lot of modulation of the inflammation from rheumatoid or lupus or psoriatic arthritis. We also have centers that are doing the treatments IV for these conditions because it can help systemically modulate that inflammatory response. So that's been very, very beneficial to date. Ross, I want to thank you. These questions are really good, exceptional. At our centers, we got approved a month ago for an IRB protocol. It's not randomized, so patients do get the stem cell therapy, but it is extremely helpful with patient protection. There's a large informed consent. There's a lot of data acquisition to make sure that patients are doing well, and if there's any issues, to analyze those. But we're very excited about it. Our second IRB protocol will be for systemic treatment, and that'll be coming out in a few months once the write-up and IRB approval goes through. So your question was, can a patient use NSAIDs excuse me, after treatment? The answer is they shouldn't. What our doctors recommend is that NSAIDs are not used after the treatment for at least 10 days. And essentially what the goal is to start, so the stem cells and growth factors and everything are placed into the area of concern, whether it's the knee, the hip, the spine, or whatnot. And then you want to have a signal. And that signal can be muted with anti-inflammatories. So ostensibly, what our docs often do is they combine, like for instance, our doctor in Oklahoma City. He understands this really, really well. So and along with the stem cell therapy, they'll do some prolozone therapy, which provides not only a signal, but also some oxygen for additional benefit. So NSAIDs should not be used for probably 10 days. That's what most of our doctors use in the protocol. After treatment, protocols are all over the place, but what our doctors recommend is that a patient for about a day limits normal activity. Like for instance, if you have a knee injection, yes, you want to move the knee. And the reason is you want, you have 3 compartments in the knee. You want to move the fluid between all the compartments. And also that helps stimulate the synovial uptake of the fluid so that it can stay around for a while. But what our doctors recommend is that it's controlled motion. So, for instance, after the knee injection, you can use a knee brace that allows flexion and extension, but limits the medial and lateral movements. Same thing for, you name it, hallux rigidus injection, ankle. You want to allow motion, but not to the extreme. Now, we have some physicians who also put in for a physical therapy protocol. So some go, all out with it, and others just, put in the 24-hour limitations. Let's see. All right, 2 more questions here. Do you see changes on X-ray or MRI after treatment, and how long after? X-ray is just not very helpful when it comes to this. We have seen some increase in joint space on X-ray. That has been very noticeable on the, and we do have some examples of that. For instance, we have, a rotator cuff, small tear that healed in a case study. We have a knee joint where the medial compartment opened up somewhat after treatment. We have a spinal case where, the degenerative disc disease, when you treat it with amniotic, you do get a lot of back pain relief. But none of these treatments are going to reinflate the whole disc. You're going to get a little bit of that, but it's not going to just, balloon it back up. It just doesn't happen with any of these treatments. PRP in the disc, bone marrow, adipose, or amniotic. Now, Dr. Pierre is asking how long prior to amniotic fluid therapy should NSAIDs be stopped. In a normal steroid injection, what doctors recommend is that you stop using those about 5 days beforehand, because there's a half-life to anti-inflammatories. And most of our doctors recommend the same, so that, when you inject the fluid, that the anti-inflammatory half-life is not over yet. So if you stop it like the day before, the half-life goes on for a few days. So you probably should stop it 3 to 5 days beforehand. That's what our doctors recommend. Ross is asking if anesthetics kill stem cells. We think they do. So our treatment protocols that we give to our doctors and that they usually go by is that the injection is performed with sterile saline or sterile water. And if anesthetics are going to be used, they be used superficially. So, for instance, you could use it, just underneath the skin or in the soft tissues, but in the joint itself, you would not inject lidocaine or marcaine. We don't know definitively if they kill stem cells, but just to be safe, we recommend, based on previous experience with doctors, that they don't use lidocaine in the joint. I'm trying to think if there's any other. So saline does not affect stem cells. Think about it. In the normal joint, there is isotonic fluid that is present. And if you have a knee injury, studies show that a lot of stem cells show up in your joint anyway. So, and the saline is basically there, and it doesn't affect the viability of the cell. So that's a good question. But that's why we recommend saline versus sterile water, either one. Now, one of the questions I didn't mention in this is, what about insurance? Well, insurance will cover a procedure if it's done as part of a surgery. So, for instance, if you do a spinal fusion and you use amniotic membrane or fluid, you can code for that as an allograft. But if a patient gets told that the actual stem cell procedure is covered by insurance, then I would just be wary of that, because it takes the FDA, and not the FDA, it takes insurance companies years to start covering new technology, even if it's very clear that it's effective. So right now, what our doctors often do is, they typically can bill for the insurance for your visit. They could bill insurance for your x-rays or your MRI or lab work, but not for the actual procedure. Okay. All right. Any other questions? I really appreciate the questions you guys posed to date. And if you have, additional questions that you think about later, just, email me. I'm at dgreen, David Green, with an E on the end, dgreen at r3stemcell.com. So I live in Phoenix. R3 Stem Cells based in Phoenix. If the procedure is performed at an ASC surgery center, sometimes the billing will cover it. I'm very, very wary about that. Some companies are advocating that it be charged out as a medical device. It's not a medical device. It's a biologic. So, for us as a company to potentially recommend that to a doctor, just get worried because it's not a medical device. It's a biologic. So to get reimbursed on that, is questionable. And I'm never going to recommend something in the gray zone that could come back to haunt. Now, your question about PI insurance, personal injury does typically cover these procedures, and workers' comp in some states covers it as well, which is great. It can go into the lien and get reimbursed, both for a facility and a professional fee, depending on where it's performed, whether it's in the office or in the surgery center. So, good questions. All right. Yes, personal injury typically does cover amniotic injections. We've seen that several times. I can't speak for the whole country. I can just speak for where our physicians have done it. But usually if it's done and put into the lien, it gets covered. That's what we've seen. Okay. All right, so I'm going to go ahead and sign off. And what will happen is this whole thing has been recorded. So we'll have replays available. We'll put it on the website, but you'll get a link to the replay anyway. Any further questions you can, or if you want to go ahead and schedule, just give us a call at 844-GET-STEM. Our answering service will be there all day tomorrow, or you can leave us a message tonight. We'll call you back. You can also email. We have live chat on the website 24/7. And if you have any further questions for me specifically, I can be reached through 844-GET-STEM, or just email me at dgreen. I'll type it in here. dgreen at r3stemcell.com. Thank you, everybody. All right. Thank you guys so much, and I look forward to hearing from you.